Welcome to Discrimination, Retaliation, Fraud, and Racketeering, episode number 6. Featured here is Dr. Charles Morgan, who works at Ocean Shores Dental in Washington State. Today's date is 7/1/2020. And I'm going to go ahead and give you a briefing about what's going on here. So, Dr. Morgan admits that his previous hygienist, which was his wife, was engaging in fraud in the dental practice. During the recorded meeting that Dr. Morgan consented to, he states about how his last hygienist would do scaling and root planning procedures, then charge out adult pro fee cleanings. Dr. Morgan was trying to order me to treatment plan and diagnose for the patients because he did not want me reporting to him. I repeatedly told the doctor that he must treatment plan and make all the decisions. The doctor states that I must do an adult pro fee cleaning on every patient. On all new patients, I must do an adult pro fee cleaning, then a new SRP or cleaning appointment after the adult pro fee cleaning when necessary. After realizing the doctor's orders for treatment appeared incorrect, I started making him sign in the patient's charts to the treatment the doctor was ordering me to provide. The doctor started trying to refuse to sign the patient chart, so he came up with a new plan of action with a protocol for each and every patient so I don't have to report to him anymore. He was trying to order me to have the responsibility of working as a doctor, which consisted of working out of my scope of practice, diagnosing, and treatment planning. Most all patient charts show adult pro fee cleanings that have been performed on the patients and charged out to the insurance. I quit the following day the protocol was written out. And you'll find out more about how the assistant, Joelle, reported to me that she had not been doing weekly spore testing for the sterilizers. And that's very important for infection control and a state requirement. As far as I'm aware, it's still a state requirement. Now, I want to go ahead and share with you the recorded meeting that Dr. Morgan consented to. It's about 20 minutes long.
I was going to talk to you about some of these charts here, just to see what appointment you got. Those patients, I guess they canceled the first two. That kind of sucks. And then Mary here. So far I got Profi, recall exam. And been doing Profis. I want to stick with the Profi for that. I mean, just 4 millimeter pockets there, so I don't know if there's recession. So Profi for that. So some mates. And then, so we need a pre-med, it looks like, for now. It looks like you said pre-med for. So they were gonna pre-med him, okay. And also initial exam, it said recall, but he's never had an initial exam, so I think we should.
That's initial exam.
Yeah.
He's just coming with a low space and probably say call.
Okay. Yeah.
So he needs a full mouth series.
This guy?
Yes.
Okay, yeah, if, I don't know if he has any other x-rays, and that's it. Do you know if he got anything sent here, though, or?
No, he's only come in for
Emergency?
yeah, so, that's all he's doing.
So do a full set for him. And if you want, like you said, if you want me to do the x-rays, before you see the actual patient, that's fine. Yeah. I mean, I know what you were saying too, but so I'm like, yeah, let's just get the X-rays first, and then have you see the patient too. So, and then gotta go over Thomas, rheumatic fever, rematting him.
Because we don't know if you had any valvular damage when you have rheumatic fever.
Okay, so I just want to make sure. Pre-med, prophy. Let's see. Yeah, some 5mm. Oh, some 6s up here.
So it's just a recall. Just check them, and if it's different, or if you notice calculus build up or something, just suggest replaying the scale.
You want me to suggest it?
You can start. I'll follow fine.
Okay. So I make sure. So we got that one. Donna, let's see. What do we got?
So,
And then, so we should do prophy, recall. There it is. Looks like some 5s.
that's an old age, so that's been a while since she was in the shop.
Yeah, some of the period charts we need to try to update some of them, you know, like these ones. Josie and Joelle, they've never even. Oh, these are just kids.
They're just trying to the adult stage.
Oh yeah, that's true. Okay. So they're good. And Donna.
She's gonna need exactly period charting and recall.
Yeah. Okay. I'll just high blood pressure.
So it's just another. So they one of the make another time you can call in.
Well, at least you did the initial, so that's nice. And some 4s, we've been just doing prophy, so we'll just wait, we'll stick with the prophy for when was that last one done?
Unless they're gonna replaying the scanning.
Yeah, that was recent. And then this one, let's see, looks like some 5s. Recall, prophy. What do you think? Stick with the prophy on it? There's quite a few 5s, but they have they lowered a little bit.
Well, unless you got a replaying the scanning, there's nothing else you can do but a prophy.
Okay. And then, are you wanting to do more scaling? Because that's what. Well, I mean, because I want. Yeah, I mean, like when they're doing some of those patients, and they got big, real deep pockets. I think we should do it. You know, like.
But first of all, they gotta do what they gotta do. Insurance, you gotta be able to get their prophy chart and their insurance get pre-authorized. Because without pre-authorization, the insurance will not pay it.
So just continue to do the prophy and then get it back for the scale.
Well, you have to do the prophy first. You can't do the prophy. You can't do a replaying and scaling without a prophy. Okay. So what you have to do is do the prophy, and then explain to them why they need a replaying and scaling. And if they agree to it, by all means, anytime they'll do it. I mean, anytime the data supports needing a replaying and scaling, then it's automatic. If they don't want to do it, then we've offered it, but we can't do anything else about it. We just keep doing profies and keep going on. They just keep documenting that they decline the replanning scaling treatment.
Okay. And well, we never fully discussed too, like, what are you wanting for, like, child? You know, like, last time you said you wanted a child, but then at what point are we switching from child to adult?
I think that's true. I think it's like 14 or 15.
Is that, and then we go to adult prophy?
Right.
Okay, so stick with the child until then?
Right, I think so.
Okay.
We don't do pregnant children at all usually.
I know, that's why
That's why the child is just, Joanne just takes care of that.
Okay, yeah, usually she does, and that's why I didn't know why on that page.
So when they get to the point where they need an adult prophy or whatever, then they have to shift over.
Okay, so yeah, that's what I was thinking, so I was like, I don't mind seeing kids.
Well, if you don't have a patient, but it's
more better for like
It's not
the business
Right.
if she can do it.
Right,
then-
so as long as it's.
Well, he did have some calculus and stuff. I
Who was
think.
that?
I think he did, didn't he?
What was that?
The 11-year-old that I seen, the child trophy.
Sometimes-
The little girl that came and he had a lot of swelling and stuff on the tissue, and he told him you needed to brush a lot more.
But a lot of the kids have a lot of plaque and that's gingivitis, but they usually don't have much recession or subgenital calculus that can't be scraped off above the gum. So.
Okay. Well, we'll just keep doing that. Have you heard anything more about the perio maintenance thing you were talking about? Like, there's no way. It seems like there's just because you're not periodontist, then we can't do them.
That's my understanding, because it's not that you can't do them, but there's no difference in what you can charge for them. Because the codes there's no separate code for perio maintenance for them. You can talk to Joel and those guys about it, but they explained to me that it doesn't do any good to call it perio maintenance, because in the whatever codes that they get the insurance codes from.
Well, I heard that since you're the doctor, that even a prophy, if you think it's sufficient for the patient, then we can do that. That's
You
what.
call it perio maintenance?
No, just do a prophy if you think it will benefit the patient.
Well, they all get prophies, so I mean, I'm not following.
I'm just saying, like, if you think that a prophy is good enough for the patient, then it's fine. But on some of those ones, I think we should definitely be trying to switch to maintenance, because I don't want to be doing like. Well, I don't even remember. I think it might have been like 9mm pockets and stuff, and be doing a prophy, because that's really not probably gonna do the patient much justice. Don't you think we should try to get them to a scaling?
Sure, you can try. That's what I try everybody. Anybody that has if they have a pocket if they have 3, 4, 5mm pockets in a quadrant, then you should automatically start saying, look, you need a replanning scale.
Well, you're the doctor, so I can't
Well,
treat
you can
that.
suggest, and then when you come in and say, hey, I found this pocket has 4 or 5mm pockets, 3 of them, and that's automatic. There won't be any. I don't know if they have enough pockets, then it's automatic.
Well, because before we haven't been doing that, that's why I'm like wondering what we should be doing.
A lot of times patients will decline, because one thing, these are older patients, so I don't know, I'm gonna die in 10 years, so I don't really care. But you can always suggest.
Well, if you think, like I said, if you think the prophy will be beneficial for him, then I just soon stick with what you're the one, leading.
It's always better.
A prophy's better.
No, it's always better if they have those pockets, and you can find, now unless they are a sanitized pocket, where they have replanning and scaling on the pockets being maintained, at that state, then you might just get away with the prophy. But if they're a new patient just coming in, and you get bleeding and they have bleeding, then whenever, I will always suggest replanning and scaling if they have the pockets.
But like on that one patient, KC, she had really heavy calculus, and it was like that cleaning was very difficult to do, a prophy on. So like, I wish on those ones you just recommend the scaling, and we could just do that, because it's like that was a very difficult.
When they have heavy calculus,
and she had deep pockets.
It's automatic.
Well, I know, but I mean, saying even before the prophy, because of that prophy.
You can't do the cleaning, you can't do replanning and scaling without a prophy. You gotta do the prophy first. And then once you do the prophy, if you say, hey, there's still a lot of calculus, maybe subgenital, then go for it. They have places where hygienists are practicing by themselves, and that's what they do. Just go ahead and do it.
Yeah.
I'll sign off on it, come and check with me or whatever, but you don't have to worry about it.
Well, have you been signing off on everything, or no?
Yeah.
You have. Every day you sign off? Okay. Because I just want to make sure that things are getting signed off on, and we're doing it, so we're on the same page. I don't want us to be on different platforms.
If they have calculus, even if
Well, how's that last hygienist do? Did she
was she chose just like said I'm gonna do
A lot of
this
times she
treatment?
would say, well, she didn't want to do replaying scaling because she thought she could do it without getting the patient numb, and a lot of these patients don't have a lot of money, so they wouldn't do the replaying scaling. So she was not wanting to push it, and we would have the discussion all the time, believe me. Look, if they need a replaying scaling, do the replaying scaling, but she was, well, I can do it without. So
You just did the prophy then?
well, she just did a lot of times, but I think she did
Because
scaling.
it looks like a lot of them, mostly it's been just prophies at all for
A lot of times she would do a scaling and not charge for it because they had no money, so she said she would do it anyway. But and that's up to you. But so
Well, I want to do the treatment, that we're charging for,
you know what I'm saying is, okay, they come in here and they say you really need a prophy, you need a replaying scaling. I don't have any money, I'm not going to do it. Well, when she did the prophy, she probably did a much more aggressive prophy than what she would have been able. A prophy to me is just knocking stuff off the enamel, but she would get a scale and try to do
that way.
some subgingival stuff because she thought she was helping the patient, and she probably was.
Yeah.
So,
So you think that basically just, I don't know, just do the treatment, but I don't know, I'm kind of a little confused because you say the maintenance is better, but then you're saying, well, the prophy is going to be the same treatment.
prophy and maintenance, we don't have, before I say, Joel. Joel. So he will explain to you the difference between recall, prophy, and maintenance.
I don't know what the difference is for that, but you can't charge it out to the insurance company, they have to pay for it.
That's
Pay for what?
The period
The
maintenance.
period maintenance.
Like, how do you just start off with the period maintenance if they've never had perio at work here?
Well, that's why I'm saying, we should go to scaling then, and get them on a maintenance cycle.
Sure, if it's that.
If you do a scaling, then you can maybe charge
You
them.
can't say a maintenance right off the bat when you've never done one.
You have to do a prophy first,
Yeah,
then you have to do a scaling, and then you can maybe switch it over to a perio maintenance. But
If that's what an perio maintenance is, because they've had a perio problem, obviously, so
well,
is it every time?
why don't we just go straight into scaling though?
you can't, you gotta do the
Sure,
prophy
you have
first.
to do what insurance says you have to do, whether it's right or wrong.
Because we don't
That's
get
what they
paid.
say. We have to go by what they say.
So you have to do the prophy first, then you can do a scaling. And then that's where the perio maintenance comes in
Yes.
after that.
And insurance says you do a cleaning first and then you ask if you can have a perio, because you can't just have one, they're expensive, $700 something bucks. Patient's not gonna pay for it, so once we ask the insurance company. then
Well, I
they
guess
say-
if you authorize the prophy, then I can go ahead and do it. But if they need the scaling, it seems like we should be doing the scaling.
We don't do the scaling if they can't pay for it.
Well, yeah, not unless we talk it over, but they might decide they have the money.
Well, you can always,
The first appointment is always an exam, x-rays, cleaning, just a prophy. And then we make a plan for what's going on.
right, so if they wanna do a scaling, then you can have them back in and do a scaling, but if they don't, there's nothing else you can do.
Yeah, there's nothing we can do about it, we just say we
You
told
can,
them they
right,
can
that's
do
what I'm
it.
saying, that's where the
They're too bad.
documentation comes in, they decline, replanning, scaling, things that you.
And unfortunately, a lot of people do here, they don't, they decline it.
Well, then should I write it up because if the patient declines because they want the prophy, so they're in, so
They'll get their
whatever.
teeth cleaned, but they don't wanna go to that next step of getting a replanning scale. So you could just write down,
But I write it down because some people have.
patient decline, perio scaling phase treatment. That's it, then you're done.
If you clean their teeth, have you cleaned?
You can do that.
Well, but then it's like I have to do what the treatment is. So if it's a prophy, I need to do a coronal cleaning, and is that beneficial to the patient? I don't
It's
know.
if it's all they wanna pay for, so.
Isn't it just, that's what we do on everybody, though.
Right, so you can always suggest a more intense, complicated treatment, which is replanning and scaling. If they decline, there's nothing else you can do.
Okay.
You just have to make sure you write down, if it was offered, they declined, then we moved on.
Okay. Well, I just want you calling the shots because I can't treat med plan. That's the thing. I wish, I had your license, but I don't.
All you gotta do is, you come in and tell
That's a
me,
risk exam every time everybody gets clean.
Right.
They say, I don't want a clean, but.
if they have a pocket, if they have pockets, you can tell them when I walked in the room, found a lot of pockets on this part, that part. And you say, if you say, I think, they need 2 parts of the scale. 99% chance I'm gonna say, I agree.
But not without the trophy first, right?
Not without the trophy first. And that's just based on because lots of, when I come in there, you're gonna have it cleaned up. I'm not gonna see the bleeding that you might have seen when you were cleaning it up. So if you say, I had 5, 6 millimeter, I could agree to disagree with pockets, but if you say I have 5, 6 millimeter pockets, here, and 3 or 4 different pockets, then I'm gonna say, okay, then he's recommending a root plane escape, and I never really did that.
Well, what do you mean that you did if you disagree with the pockets?
Well, I mean, I can get a pocket, you'll say it's 6, I'll say it's 5, you'll say it's 6, I'll say it's 7. It's just this difference of, we may not come.
Well, then we need to make sure that we talk about that ahead of time. If you think a pocket's different, you need to.
Well, if we're within a millimeter of each other, then that's all.
Then yeah, we're fine. And so far, we've been with.
I look at your stuff, you say, okay, that's a 5. Sometimes I get a 3, sometimes I get a 5, but I don't care. Yeah, you said 4, we're within.
Well, you find my work accurate, right?
Fine, yes.
Yeah.
So, I mean, hell, I'll say it's a 6. Just because I said 6 so many days. You get it, it's a 5.
You know more, not say you know more, but you know more what you're saying, because you see it every day, you're doing it every day. So you tell him this is what I recommend, and then he's, oh, yes, no, he'll agree with you, so. Unless he says totally different.
I would always recommend a scaling before a prophy,
But that would be fine if they're all fee for service, but you can't do that without.
And not everybody needs a scale, though. Does everybody need a scale?
No, when they do, like that one patient that we
It is
had.
better,
Sure, because when you're polishing over some, can't you take off some of the calculus above the gums and not be.
Well, that's what the
That's what
prophy
you're doing,
tries to do.
yes.
Well, that's what a prophy
Yes,
is.
so-
It's the super tangible stuff off.
Yeah.
And then the scaling is just anything subjective.
And that's what most people are worried about, is they're saying, so they don't get it, so you have to explain it to them, and they can make their choice or not.
We're ready for this guy.
Okay. I just wanted to make sure that I knew what was going on.
So that's the whole recorded meeting with Dr. Morgan. Now we'll go ahead and get started on some more. Now, the Department of Health in Washington State and the Labor and Industries gave up my confidentiality, and it was against the law, and that's why I'm exposing this online. Now, I currently do not have my Bachelor's of Applied Science and Dental Hygiene degree that I earned, and Sherry Pedrusny, the Yakima Valley College teacher and program coordinator, is refusing to give this to me. Sherry Pedrusny ordered Wenatchee Valley College Leslie Lampkin to engage in fraud and steal out my assignment requirements, and the entire college is trying to cover it up. Leslie Lampkin illegally removed my summary number 1 assignment that consisted of 2 summary assignments, and replaced my summaries with 2 additional non-required gun essays that were used to abuse me. He failed to install my library packet, made misrepresentations on my final 2 research papers or expanded essays to make them look like regular essays so Sherry Pedrusny could downplay and act like I didn't do a true research paper and deny my Bachelor's of Applied Science and Dental Hygiene degree. I have emails where Sherry Pedrusny admitted English 203 was my last college coursework to get my degree. Yakima Valley College is trying to cover up the fraud. The Washington State Board of Community and Technical Colleges is trying to cover up the fraud. Leslie Lampkin is most likely cheating the students at Mansfield School District in Washington State because I have public records to prove that they're missing assignments. If he won't fix the fraud that I caught him doing, I'm sure he is frauding the children. Now, my attorney David O. and David O. Defense Firm broke the contract for my federal court lawsuit and stole $10,000 from me because he was either intimidated, threatened, and or bribed by the clerks Pam Howard, Angela Knoll, Debbie Brazel, the biased Judge Salvador Mendoza Jr. at the Washington State Eastern District of Washington Federal Court, and Attorney General Bob Ferguson and Assistant Attorney General Derek Taylor. All don't care about students and children as well as healthcare fraud. the Attorney General Bob and Assistant Attorney General Derek Taylor are using taxpayer dollars to assist criminals such as Sherry Pedrusny, the Yakima Valley College Dental Hygiene Program Coordinator and Teacher, and Leslie Lampkin, the Wenatchee Valley College English 203 Research Teacher. So my attorney abandoned me because they scared off my attorneys and they didn't want me to have anyone to defend me. And I got to show some proof of that real quick, and then we're going to go ahead and end this. Well, here is Dr. Charles Morgan from Ocean Shores Dental. This is the legal protocol that he wrote up where he wanted me to do adult prophies no matter what first. And here's proof that David O., the Seattle, Washington attorney, came into my federal court lawsuit, and then they threatened and or bribed him to abandon me. Here is proof of a contract that I paid $10,000 in full to get my Bachelor's of Applied Science and Dental Hygiene degree, and I still do not got it, and he abandoned me and stole the money because he was threatened and or bribed. Now, here is proof that right after I turned in the complaint with Dr. Lori Keller at Wenatchee Valley College, I wrote the pro-gun essay is still not graded. He's removed the grade for summary number 1. It was a 100-point assignment. I received 93 out of 100. I have pictures to prove what is happening. I hope this is not a form of retaliation for filing this complaint. Well, then the Department of Health, I haven't spoke to them in approximately like 4 or 5 months at all, and then all of a sudden they're trying to ask questions about hearings when I already gave them the hearing, the recorded meeting that Andrea Barbano consented to for Dr. Blake Perry. They said Dr. Blake Perry committed no violations, and they closed the case because the evidence does not support a violation when clearly he got caught lying under oath to Judge Jan Barnett, and he was using illegal software and committing insurance fraud under my name and all kinds of stuff. Here's Sherry Pedrusny, the Yakima Valley College Dental Hygiene Program Coordinator and Teacher. Here is Andrea Barbano, the manager at Dr. Blake Perry's office. There's Jennifer Elliott, a secretary that Andrea Barbano was teaching how to change my chart notes. There's Regan Bellamy, HR director at Wenatchee Valley College that was involved. Dr. Tio Flores, Wenatchee Valley College vice president that was involved. There's Dr. Jim Richardson, a president that was involved. Hammer, the bias judge Salvador Mendoza Jr. at the Washington State Eastern District of Washington Federal Court. And they put it in the wrong venue, the clerks, Pam Howard, Angela Knoll, and Debbie Brazel. They've put it in Richland when I filed all my papers in Yakima so they could have it with the biased, corrupt judge that cheats. Here is Leslie Lampkin, the English 203 research teacher, and he's the one that stole and frauded my assignments through Sherry Pedrusny's orders. He's also cheating the kids at Mansfield School District in Washington because they have missing assignments. If he won't fix the fraud he committed that I caught him doing, then he's probably just cheating them. There's Dr. Blake Perry, who was involved with the legal software and everything. And there is William Pickett, which will explain more about how he has involvement with the Bar Association, and he's trying to cover up stuff like my posts on Facebook. And there's Dean Joey Walter at Wenatchee Valley College who's involved, and Dr. Lori Keller's right here who was involved, and I emailed after Leslie Lampkin stole out my summary number 1 assignment. Now, I appreciate you watching my videos. Please spread my albums, my evidence, my Facebook, my Twitter, YouTube. I care about the safety of all the students and children, the healthcare professionals like the hygienists. I want to get more into the labor and industries violations from Dr. Morgan, and just kind of explaining, and more about how the clerk, Judge, Salvador Mendoza Jr.'s clerk Debbie Brazel, that was threatening to put me in prison because I'm turning all this illegal activity in, and I feel like they're trying to frame me. So, but I have all the evidence to prove otherwise, and that's why they wanted to get rid of all of my evidence. They want to incinerate my evidence, according to Pam Howard, and trying to convince me I didn't have evidence, and then they might even be running illegal software at the federal court, and that's how they were going to maybe delete out everything once they tried to frame me. So I look forward to me on the next episode of Discrimination, Retaliation, Fraud, and Racketeering. Thank you very much.